Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillah. In less than 2 minutes, I'll try hardly to explain how do we treat cases of severe acne. Usually, a patient comes to the clinic complaining of having a lot of cysts and scar of severe acne, unresponsive to conventional therapy. And classically, we give those patients isotretinoin 1 milligram per kg per day for around 16 to 20 weeks. But actually, giving this drug is not that easy, because this is a very malicious drug, very malicious. How malicious? It's malicious in two ways. The first one, if the patient is female, you should do a pregnancy test to rule out a pregnancy, and you should advise the patient not to get pregnant during the treatment therapy, during the therapy duration, not to get pregnant. And the other thing here, if the patient is in fact on tetracycline, you should stop the tetracycline, because combining tetracycline and isotretinoin will lead to a state known as benign intracranial hypertension. Because research has shown that the combination of both isotretinoin and tetracycline leads to elevation of the cerebrospinal fluid. Thus, it is highly recommended not to combine those two medications. Now, here is a funny biochemical fact. This isotretinoin is a retinoid, and from a biochemical perspective. And this retinoid means, it has an oid. Oid means similar to retin. So in fact, it's similar to retinol. What is retinol? It is vitamin A. So in fact, cases of severe acne are treated by giving them vitamin A. This is the mere biochemical fact behind this therapy. Now the question is, what does vitamin A do to those patients? The simple, straightforward answer is that vitamin A reduces sebaceous gland function, and it also reduces keratinization, thus improving the general condition for the patient and treating the acne eventually, God willing. And that's all for today.